Hi, Dr. LaQuista here, and today is World Mental Health Day, Saturday, October 10th. And I just wanted to come on and do a quick video about some of the common mental health issues that I see in my practice, and to also give you all some tips and some guidance and recommendations that I have. And so, just a little bit about myself. I'm Dr. LaQuista Arena. I have a private practice based in New Jersey, but being a military veteran, I kind of moved around a lot over the years, and so I have collected licenses from several states. So I currently operate a telehealth only practice since COVID, which has been great that it allows me to see clients in those states that I'm also licensed. So New Jersey, Pennsylvania, Connecticut, Georgia, North Carolina, looking to add a couple more states to my list soon. So I primarily work with women, professional women, and also military women and veterans who have experienced trauma. And so one misconception about trauma is that trauma is this big thing, this big event that has happened to you, such as maybe 9/11 or going to war or being in a major accident, near death experience. But trauma is a little bit more complex than that. What I'm seeing now is a lot of racial trauma, which I think it's always been there, but it's more prevalent that we are aware of it more. And so, with the kind of shift in the country and social justice, the Breonna Taylors, the George Floyds, Trayvon Martin, Sandra Bland, like the list goes on and on and on. Like I could literally probably spend like 30 minutes to an hour listing all of the names of Black people, men and women, and some children who have died at the hands of police or police brutality. So it is something that is very real, and it's one of those topics that is very polarizing. So Black Lives Matter, Blue Lives Matter has somehow been politicized, but just to kind of bring it back into focus, racial trauma is real, and people are coming to therapy because of racists out there in America. And I think the more we get closer to like the election and tension is high, people are on edge. And two of the most common reasons people go to therapists is for depression and anxiety disorders. And so COVID was kind of like a trigger for everybody's anxiety. So for people who already was in therapy and had like some anxiety going on, they were probably a little bit better prepared to kind of deal with COVID because they had some tools in place. They knew what to do. They reached back in their toolbox and remembered all the things they had been working on in therapy. But for a lot of people who had, going on with their lives, didn't have time to kind of think about things because our lives are so busy, COVID really hit like a ton of bricks. And so you're sitting at home, you don't have your normal routine, and it's just you and your thoughts. And what do you do at that point? So fortunately, a lot of people did get connected with therapists. I will be providing some links in the comments or the description of this video on how you can connect to a therapist, because this is going to be one of the most important relationships you have. One of the most intimate relationships you have is with your therapist. So you want to make sure you have a good therapist, a therapist probably maybe who looks like you, Most of my clients look like me. They specifically come to me because they want to talk to a Black woman therapist or a Black therapist in general, and that is okay. You want to have that shared connection. So there are directories where you can filter and sort by ethnicity, by language, by modality that the therapist uses, sexual orientation, whatever. You can find a therapist who speaks to you and you feel connected to. Because again, this is going to be one of the most important relationships you have, and so you do want to make sure you feel that shared connection, and you don't have to give your therapist like a decoder book to kind of decipher like any of those cultural probably nuances or sayings that you may have like in your culture. And so me, I'm from the South. I'm from Georgia. I know you probably can kind of hear it like in my voice. And so you may hear like some y'alls or ain't or yes, I am a doctor, but I'm also real. I'm human. This is my culture. I'm Black. I'm a Black female who has grown up in the South, moved around for the military. And that's just who I am. It is what it is. And so I may not always speak as refined as some other doctors, but that doesn't take away from my education and my knowledge and my ability to connect with my clients. And so I just wanted to kind of put that out there for you all. And I also want to talk a little bit about stigma. And so stigma is it is something that has been prevalent in the Black community as far as getting mental health treatment since forever. And I'm happy to say that I do see kind of like the shift and the turn and it being okay for Black people, my people who look like me to get help. This is true for the military community as well. I'm a veteran, been in the Army, recently retired from the Army Reserves, but I also did 2 tours in Iraq. I did an AGR tour. So I know the stigma for this community is real. It's almost similar to that of like the Black community. And I think some of that goes to just like having access. So maybe back in the day when your grandparents or your great grandparents were kind of growing up, people that look like me didn't talk about going to therapy. That was considered a luxury, a white person thing. That's what white people do, and I don't say that to be offensive, but that's how we would think. And we relied a lot on the church to handle our issues, our family issues. But we all know that in our families, we've had like a cousin or uncle or someone who, never really had like a official diagnosis, or if they did, we didn't know about it, but we just knew something wasn't right about so-and-so. Uncle so-and-so, he's not right, or he's special. And, we can kind of laugh and joke about it, but this is something serious. Mental health, mental illness, it not only affects the person, but it affects like the family and the community as well. 2 of the most common reasons people come to therapy is because of depression and anxiety. But there are several more serious and persistent mental illnesses that require more intensive treatment than just your typical depression or anxiety. And I'm not discounting the severity of people's symptoms when I talk about depression or anxiety, because again, like I said, these are two of the most common issues that people come to therapy, particularly like in my practice. And so I think it's important that we talk about just how mental illness can affect, again, like the person, the family, the community, and everybody. And so we do know that healthcare is expensive. And so if you don't have access to healthcare, you're less likely to go out and seek a therapist. Or if you don't have additional funds, you are less likely to look to search for a therapist, because you may not know or be able to even find a therapist that you can, one, afford, two, that even if the therapist does take insurance, who is in network with the plan you may have. Or again, like finding a therapist who takes insurance is hard, because insurance is a very complicated industry and process, and there's a lot of red tape. And so again, access is very, very important. And about, I think it's between 19 and 20% of the U.S. adult population who has a mental illness also has a substance use disorder. That means that they have some comorbid condition going on. So it may be depression and alcoholism, or maybe schizophrenia and, some other substance use disorder, whatever the case may be. About 19-20% of this, of people with mental illness do also have that substance use disorder. And that's not a small number. So if you think about it, 20%, that's a pretty significant number or amount. And so when we think about how this affects like the person, why is this person seeking substance use? You have to really think about like what the symptoms are, how it affects their lives, and why are they using? Like, is it to escape? Do they get some relief based on what type of mental illness they have, and what are some of their symptoms? And so I don't think it's fair to kind of just say, oh, well, this person uses drugs or has a substance use disorder, and not really know like the reasons behind it, or how a person could possibly use that to cope, or what their reasoning is. So the two go hand in hand. And so again, people who have serious mental illness, just like with anything else, is at increased risk for chronic diseases. I actually did my my dissertation on mental health, so depression and hypertension and chronic pain. So as a veteran coming from Iraq, this is actually how I got into the mental health space. My first tour to Iraq, I came back, I had trouble reintegrating back with my family, was struggling with some PTSD, anxiety, and depression. And after getting help with a social worker, I decided to go back to school and get my master's, because I wanted to do that, because I saw so many friends and battle buddies kind of getting lost or taking their lives because they refuse to deal with their mental illness. And so that's how I kind of got into the mental health space. And then my second deployment, I came back again, had trouble reintegrating. On top of that, I had chronic pain because I had hurt myself the first time, back injury, and I had been dealing with chronic pain for years. And so I was very interested to study how chronic pain and depression went hand in hand, and how behavioral changes, so increased physical activity or proper nutrition or therapy, would actually affect outcomes. And so that's what I did my research study on. And I won't go all into like the results, but there was evidence to support that would increase access to therapy and proper nutrition and a fitness regimen, that people's depression improved and their pain, their chronic pain or the pain scale went down. And so that was very interesting to me. But while doing my research, I found a lot of evidence to support how depression and anxiety really cost us all globally. So when you think about that, you think about how many people are out of work because they're depressed, or they're having a mental health day, or they're in chronic pain, or whatever the reason. And so it's estimated that depression and anxiety disorders account for about $1 trillion each year in lost productivity. And so I think companies are taking notice of this, and there are a lot of great organizations who have provided their employees with access to no-cost mental health treatment, and encouraging people to invest in wellness, so that they're able to kind of take those days and making sure that they're being a little bit more proactive towards their mental health instead of reactive. So that was very interesting. But did you know that depression is the world's leading disability? Yes, so depression. And we are a depressed society. Again, COVID was a trigger for a lot of people to really confront some of the things that they had not really been dealing with. And so I want to talk about just give you a little sense of like some of the warning signs of mental illness, like in general. Some are related to depression or anxiety, and I'll link to everything so you'll have resources. But if you're feeling sad or withdrawn for more than 2 weeks, if you're thinking about harming yourself or ending your life, taking risky behavior, out of control behavior that is outside of your norm, suddenly having this overwhelming fear, racing heart, physical discomfort, changes in your appetite, your weight or loss gain that can't be explained by like other medical conditions, more serious mental illness. So you're hearing, seeing, or believing things that other people can't hear or see, or that aren't real. Drastic changes in your mood and behavior, your sleeping patterns, your sleeping habits. If you're staying up for 48 hours nonstop, no sleep, and that can't be explained, that could be a warning sign of a mental illness. Excessive use of alcohol or drugs, extreme difficulty concentrating or staying still, moving so fast that people notice, or moving so slow that people also notice that as well. Um, Fears and worries that kind of prevent you from living your day-to-day life or enjoying your daily activities. And I know you're probably saying, oh, well, COVID. Yes. So again, disclaimer, COVID is like a light, like a black light that kind of shined on everything that we have been ignoring. So it's kind of like you go to like a hotel and it looks all clean, like the bed looks clean, but if you get like a black light, you see all these specks and stuff there. So COVID really shined the light on a lot of things that people have been ignoring. And so I do take that into consideration, but you really have to be honest with yourself. Like, okay, is this a COVID thing, or is this something really more serious that is going on? So your family and friends may even notice changes that you may be unaware of. So it is very important that we check in and we stay connected to one another. Social distance, of course. But if you're in the household and you notice something, or a family member or loved one points out something to you, that doesn't necessarily mean you have a diagnosis or it means something is wrong with you, but that may be maybe I need to look more into that. And so that's where a therapist would come in. And there are so many different directories or ways you can connect to a therapist. And so a lot of your favorite therapists are on social media, on Instagram, and they're giving out great tips on how you can kind of cope with certain things. So if you have anxiety, like what are some of the common anxiety tips? If you're having depression, what are the signs you look out for? And so if you want to follow some of your fave therapists, just go in there and just search like hashtag therapist, or try hashtag like your state, and then therapist, or if you're looking for a Black therapist, hashtag Black therapist, and I'm sure you'll connect to a lot of people who may speak to you. And that does not substitute for going into the office and getting therapy and getting treatment, but it is a way for you to get introduced to some ideas and also know who's out there. Again, like these directories, so like Therapy for Black Girls, Clinician of Color, they just came out with a new directory. I'm not sure if it's live now. There's so many different directories, and you can filter again by ethnicity, by language, by sexual orientation. So finding someone who looks like you and who speaks to you, you can do all of that. You can also check like your insurance. So if you have insurance, most insurances have like doctor finders or directory, and you can search via those directories. You want to reach out to the therapist, try calling or emailing, and asking like important questions. Do they take your insurance? Are they accepting new clients? What is their specialty? And hopefully that therapist will be able to offer you like a free consultation just to see if you're a good fit. And then just really discussing like what you're looking for, and what your issues are, what your concerns are, to see if it is a good fit, and moving forward from there. And there are a lot of great a great post on how to actually connect to a therapist. But again, I'll link all of those resources for you. But I just wanted to come on and talk a little bit about that and about stigma and, just making the conversation easy, normalizing talking about mental health and saying, hey, I'm not okay. And I say it as a therapist. I have been in therapy. That's how I got into the field because a therapist helped me. And it's okay to say I'm not okay, but what are you going to do about it? You're not okay, and you're not alone in saying that you're not okay. A lot of people are not okay right now, but what are you going to do about it? Are you going to reach out to someone and get connected to help? If you don't have insurance, what resources are available for you? There are a lot of organizations right now who are providing access to mental health care to those who don't have insurance or low income. If you're working, many employers have EAPs, so employee assistance programs, where it's no fee for you to connect to a therapist. So typically it's maybe 3 to 5 sessions, but some companies are paying for 20 to 30 sessions for their employees to connect with a therapist, and that's $0 out of their pocket. Like, this doesn't even, it's not even connected to like their health benefits. It's just an added benefit. So reach out to your human resources, see what's available for you. If you're under, I think, age 26 or possibly on your parents' insurance, see what they have. Ask them about their insurance coverage and what benefits they may have available to them and you as a family member. Again, today is World Mental Health Day. I'll probably be doing another video. I'm actually in a training on a break right now, so I don't have much time to really spend on this as I would like, but I did want to come in and acknowledge the day, to say that you are not alone if you feel like something is off. If you have something going on, you are not alone. We're dealing with a lot of grief, loss of opportunity, loss of loved ones, a lot of trauma, collective trauma, racial trauma, anxiety. All of these things are outside of our control, and we don't really know what to do with that. And so connecting to someone who can help you, or if you don't have access to a therapist right now, talk to someone you trust. If you have like a trusted loved one or friend, like, just talk to them. And I encourage you to check in on your loved ones, even the strong ones. They probably need it the most, just to say, hi, hey, how are you doing? Are you okay? No, are you really okay? Because we get into the habit of saying, yeah, I'm okay, but we're not really. And so sometimes the outside doesn't match like what's going on the inside. So paying attention. So being vigilant, being present in the moment, of your surroundings, of your loved ones, of yourself. Take some time, connect to yourself. Take 15 minutes a day and just, give yourself that grace. And so I'm going to end there. Again, I will have everything linked either in the comments or the descriptions. You can find me on social media, IG at LaQuista Irina, all my social media